Hello everyone, it's Mo here from Pareto and welcome to our Pareto pixels. We call them Pareto pixels because we know that you need to cover lots and lots of conditions as part of the matrix, and in those conditions are various different aspects, and there are some difficult aspects which can get quite difficult to learn, to memorize, to teach, and to also apply. And we want to make those easier. So we're going to go over hypertension today, and we're going to specifically focus on diagnosis. So let's get to it. Blood pressure really is very simple. It's the force of blood flow exerted upon the walls of the artery upon the contraction of the heart. The walls of the artery can change physiologically and pathologically as you age. So that includes the elastic fibers as well as the smooth muscle fibers. And diagnosing hypertension is ultimately an act of identifying the norm, not the exception, because blood pressure can increase acutely. For example, if someone is unwell, for instance, if someone is in pain, or even if someone has anxiety when he or she sees the PA coming to them with a venipuncture ready to take some bloods, as an example. This means that diagnosis of hypertension really is about balancing measuring blood pressure over a period of time and then dealing with the variation in diagnostic criteria with age. NICE gives us quite an easy way to look at things, and we're going to split blood pressure diagnosis into stage 1 in one camp and then stage 2, 3, and everything else in another camp. Stage 1 hypertension is diagnosed by a clinic blood pressure reading, firstly, of 140/90. Now, that's not just one reading, but it's 1, 2, and 3, ideally in a single setting, and that gets the ball rolling. After that point, the blood pressure reading is confirmed either with home blood pressure monitoring, where patients are to measure their blood pressure in the morning, afternoon, and evening, which doesn't always work out, or ambulatory blood pressure monitoring, where an automated blood pressure cuff is put around their radial artery and they don't need to do anything about it. Now, once stage 1 hypertension is diagnosed, are they to start treatment straight away? Not necessarily. If you get an exam question that asks you what to do once someone has hypertension, and if they've got stage 1 hypertension, you only start them on medication if they've either got diabetes, renal disease, cardiovascular disease, or calculated Q risk of more than 20%. Otherwise, it's important to offer lifestyle interventions to begin with. However, if it's stage 2 and stage 3, then it's pretty straightforward. You treat them according to the treatment algorithm. Now, we're not going to go through the treatment algorithm because it's an algorithm, and hopefully it should be straightforward, something that you need to commit to memory. But really getting your head around diagnosis is important. So I hope this pixel is now clearer. And there we go. So we hope to see you again in our next video. Thanks a lot. See you now.